When one undergoes a major surgery, being put to sleep or numbed is part of the medical procedure. But for preterm babies, infants and children, this is done differently under specialized care. My name is Beldin Waliaula, and on this week's episode of Health Watch, we focus on pediatric anesthesia. We'll also be talking to Perez Obonyo, the principal of Gertrudes Institute of Child Health and Research, to tell us how they're equipping nurses with specialized skills to handle children. Unlike adults, children are vulnerable. Therefore, extra care and precaution need to be taken before, during, and after a child undergoes surgery. This includes anesthesia. Pediatric patients are classified differently, including neonates who are babies below 1 month of age. An infant is a child up to 12 months of age. A child is one aged between 1 to 12 years, while an adolescent ranges between 13 to 18 years. Since these minors are all under parental guidance, they need consent from their guardians before undergoing any medical surgery. In all these groups, the use of anesthesia varies considerably depending on the operation.
During cold times is when he'll start seeing the symptoms.
Naomi Omayo's 4-year-old son has been struggling with adenoids and tonsils for some time.
Came here on Friday because he has been having the problem with the sinuses. He has been having a cold most of the time. So we were advised to come and see an ENT doctor, Dr. Ambira. So that's when we got the appointment. He advised on drugs and also surgery, but he said with the drugs, it's something which is on and off each and every time. So we decided that surgery was better because it's a long-term thing.
For any parent or guardian, watching a child being wheeled into theater can be an unsettling moment.
We were kind of nervous at first, but after we were okay. But then yesterday, that's when the reality started to sink in, like the surgery, and we were afraid, having second thoughts, but then we decided to come.
When a child is undergoing any surgery, most parents usually have a lot of questions while being on the edge. However, nurses and anesthesiologists always explain what to expect before, during, and after a child has had anesthesia.
They first check the baby, if he's breathing well. I think that's the first thing, when he last ate, and also if he has any allergies or any diseases in the family. Yeah. And then you wait before they take him. The anesthetist first asked if he had an injection on his hand. That time he didn't have this injection in his hand. So, and then he said, they'll use the mask they put on the nose, and then it will take a few, like a minute or so, and the baby is asleep. So he just explains that, and then he asks you if you have any questions. What do you think? No, you just ask, like, is it painful? How does it work? So you say it's not painful. Yeah, they'll just take the baby. Maybe when they take the baby, you'll hear the baby crying. But so I waited over there at the door when the baby was crying until I heard there was no crying, and then we just leave there.
Anesthesia used depends on the child's age and procedure. There are different types of anesthesia. One of them is the general anesthesia, where a child is put to sleep. We have regional anesthesia, where one large area of the body is numbed. Lastly, we have local anesthesia, which involves a small area of the body being numbed. Luckily, children don't take long to wake up from anesthesia after surgery. Once the operation is completed, Full recovery from anesthesia continues in the recovery room. This usually takes between 1 and 2 hours. Expect your child to be sleepy and to doze on and off often. Some children become very excited and confused when they wake up or delirious. This reaction can be disturbing but usually lasts only for a short time.
When I went there, he was being, I think, wheeled from the theater. He was coming towards the entrance. He was just restless, not opening the eyes, but you could hear the voice of him, like trying to cry. But then the anesthetist, he came and he was with the baby. I'm not sure if there was the anesthetist or the nurse. And then he told me that it's because of he's trying to wake up from the procedure. I think yes. So that's why he's feeling like that.
Dr. Praxidis Okutoi is a consultant pediatric anesthetist working at the Gertrudes Children's Hospital. She explains that children are not young adults.
Children are not small adults. That's what we always say. Children are not small adults. They have unique characteristics on themselves, and that is why their area is a specialist area, because they have different physiology, and that means different pharmacology. That means different ways of administering anesthesia, given the differences in their anatomical and physiological characteristics as they grow. Ideally, as they grow adapting into adult features. But before they have attained that, there are specific things about their body functions that have to be taken into account. So, indeed, how we anesthetize children is not the same way as how we anesthetize adults.
She says that before a child goes through surgery, there must be preoperative preparation.
Actually, to examine that child and confirm the ailment, and also examine and confirm that either they are fit for surgery or not fit for surgery. However, if they are not fit for surgery, but it is an emergency, then it is incumbent upon the anesthetist to know how to provide anesthesia on this background of a patient who is not stable, who may have diseases, may have other conditions other than the surgical emergency. You see, for example, a child may have upper airway obstruction, but has an urgent kind of surgical issue that needs to be dealt with. So this is where the specialty also comes in, that even on the background of this other problem, you must be able to provide anesthesia for this surgical emergency.
Inhalation and intravenous inductions, or IV, are used in pediatric anesthesia, and many factors influence the choice of the induction method. Inhalation induction has traditionally been the preferred technique since most children don't like being poked by needles. Inhalation induction is also the choice in children whose veins are not easy to locate.
We would do two things. We can use injectable medication to put them to sleep, or we can use gas to put them to sleep. Usually in young children, gas is the more preferred way because children are afraid of, anyone is afraid of injections, but you expect that it will be worse in children. So if we are not able to put an intravenous access, we prefer to start by gassing them down. We give them a gas that actually makes them go to sleep. It obtunes their level of consciousness. And once they are asleep, then we are able to put an IV line in, and then now we can proceed with the rest of the anesthetic. Because, as I said, it's a mixture of things. There are different drugs that we give depending on the disease condition, and the type of surgery that you're going to give. And also, we also give some intravenous fluids depending on how long the patient has starved. Sometimes we also need to give blood and blood products. So hence the essence of the intravenous line. A preterm can go through an anesthetic and surgery, and an older child can also go through anesthetic and surgery.
In general anesthesia, the medicine used may be inhaled through a breathing mask or tube. It may also be given through the IV line. This is a thin plastic tube inserted into a vein. A breathing tube may be put down into the windpipe to maintain proper breathing during surgery. Once the surgery is done, the anesthesiologist or nurse anesthetist stops the process and the child wakes up in the recovery room.
They are vaporized gases, but they induce anesthesia. They change the level of consciousness from awake to asleep or unconscious. Albeit this is a reversible situation. It's not permanent. It's just to facilitate for the surgery, but we are able to reverse that situation. Once we switch off the gases, the gas is breathed out, and we give oxygen. Oxygen is we use it as a driving gas, also just to maintain the life of the patient. So we use oxygen to drive that gas into the patient, and we also use oxygen to wash it off.
The risk of a child under anesthesia is real, as is in adults.
The anesthetic risks are higher in children, especially the younger ones and the very sick, because of their limited physiological reserve in every way. They have a limited cardiac reserve, they have limited respiratory reserve, they have limited even fluid reserves. So for example, if a child bleeds 20 mils, it can be very significant compared to an adult bleeding the same amount. We also can have situations where we can numb in children, very similar to what we do to adults. For example, a child who is born before dates, the ones we call preterm, or they have history of having been born before dates. Usually they are born with some conditions like hernias. Hernias where abdominal content protrudes through spaces that have not closed. And they may require surgery. Now, one of the things that anesthesia may do when you give it to preterms is that they will take long. Sometimes they take long to emerge from the anesthesia. So if you want to bypass that, you have an option of doing the numbing, just the same way we do in adults.
The unique thing is how children are handled under anesthesia compared to adults. This is because most of their organs are not fully developed.
What drugs we use, it is not different, because the drugs that are used for induction of anesthesia are the same for all populations. What differs here is, one, the choice for the condition, two, how much drug that is given. This is where the difference is.
She says there are only 20 pediatric anesthetists in the country. This shortage was brought about by lack of training in the country before. However, the specialty is now being offered in the country. The disease burden of children needing surgery is also high, thus driving up the demand for anesthesiologists.
We still have a huge surgical burden of disease. Children actually constitute about 50% of the population. Now you can imagine 50% being served by 20. I mean, it is completely, we would easily conclude that there are a lot of children whose needs are not met. But how we are trying to bridge this is by training. We realize that it will take a long time before every county even has a pediatric anesthetist. But we cannot wait for that. So what we are doing is trying to train other anesthesia providers. We have anesthetists who are not pediatric anesthetists. We also have another level who are not even degree holders, but they've done a diploma in anesthesia, and these are the ones actually who cover most of the country. So what we do is to train them on the most necessary interventions that they need and give them the skills they need to have to just make sure that at least a child can survive before they are able to be referred to where the specialists are.
Where there's a pediatric surgeon, there should be a pediatric anesthetist, but that is not usually the case. The country is facing a shortage, a situation that is exposing the young ones. Belden Wadiaula, KTN News. On our interview segment today, we'll be speaking to the principal of Gertrudes Institute of Child Health and Research, where she'll be sharing how the institute came to be and the specialized programs they offer to people and the nurses in the country. And I'll start by allowing her to introduce herself.
Ms. Perez Obonyo. I am an employee of Gertrudes Children's Hospital, but specifically based at the Gertrudes Institute of Child Health and Research. I have been here for 13 years. So at the institute, I am the principal and the training manager. And other than being a principal, I'm also a trainer in all the courses that we offer and also the emergency courses. Yes, so that is who I am.
And maybe you've been here for 10 years. At the institute, or you saw the institute coming up, how did it develop?
Okay, the institute started in the year 1999, basically as a center to train the Gertrudes Hospital personnel on emergency courses. So it started small, just to help the staff learn how to offer emergency care. But since 2005, the school has grown. We were accredited in 2005 to offer nursing courses, and basically the Higher National Diploma in Pediatric Nursing. That is a specialist course for those nurses who want to take care of children, who are interested in at least giving healthcare to children. So in 2013, we gained another milestone whereby we were accredited yet again by the Nursing Council of Kenya to offer pediatric critical care nursing, which is also a higher national diploma course. In 2016, another milestone, we were accredited now to offer diploma in Kenya Registered Community Health Nurse, which is a direct entry from high school. So this is basically a course for those who aspire to be nurses. So those are the nursing courses that we are offering, and you can see the school has steadily grown. Other than the nursing courses being an institute, we also offer other affiliated healthcare courses which are not nursing. And this includes emergency medical technician course. This is a course for those who aspire to offer healthcare to those who are injured pre-hospital, meaning before they reach hospital. So that when people are involved in road accidents, for example, or they are critically ill and they're outside the health facility, they're able to be taken care of by people who have gone through a form of training. So that is emergency medical technician course. We also offer a healthcare assistant course, and this is a course that is given to people who aspire to work in the hospitals, but they are not qualified enough to be nurses. So they work alongside nurses to offer care to the children. And why this is very important is because where the healthcare is headed is that we don't want just to employ anybody to handle the patients. And I'm talking of children because we are especially a children's hospital. But these healthcare assistants can work within a pediatric facility or within other healthcare facilities outside pediatrics. We have a short course known as pediatric phlebotomy. And what this does to people is we train people to know how to do cannulation or to draw blood from the veins. Why pediatrics is because they have very small veins, and most of the people are not able to access veins in small children.
So one of the programs that you offer is nursing, and do you think that you're filling the gap that is there in the market to begin with? And also, do you think that when you train these nurses to be better, we'll have a healthier community?
Yes, exactly. So we are the only, Gertrudes Institute of Child Health and Research is the only institution that deals with pediatric specialties. So most of our courses are geared towards child health, which is a gap. You know that very well that we still have a lot of newborn, infant and child mortalities within our country. And not everybody who is trained as a medical healthcare provider is skilled enough to handle children. They are a very special cohort of human beings. There is a way they respond to illnesses. There is a way you need to communicate with a child. There's a way you need to assess that they're in pain, categorize it and manage it. And that one is only done by the people who have been trained in pediatric specialties. And that is what really we do. And that was the gap. So as we speak, I think within the region, not only in Kenya, within the region, we are the only institute that majors on pediatric specialties. Yeah, so that was a gap, and that's why we came in with those 2 higher national diploma courses for nurses. But we also offer other courses for the doctors. We do pediatric endocrinology, and right now we are also doing pediatric cardiology, which is still falling within our Institute of Child Health and Research. The researchers in Kenya and reports show that among the healthcare providers, nurses form around 58% of that workforce.
At the moment, the country is grappling with the shortage of health workforce. And so anyone who will want to join the institute, what are the prerequisites, things or conditions she'll have to fulfill before they join your institute? So
Gertrudes Institute of Child Health and Research is a fully accredited institution by the Nursing Council of Kenya and by TVET. So basically it means we are recognized within Kenya, and not only within Kenya, even internationally. So we contribute a great deal to workforce within the country and outside the country. Actually, just before I forget, this institute has trained people from Zambia, we are training from Rwanda, we have trained from Zimbabwe, and we have also trained from Nigeria. But within the country, we contribute largely to the workforce that are within the private hospitals and also the government hospitals. So how you can join us, we follow the standards that have been set by the accrediting bodies, basically the Nursing Council of Kenya and the TVET. So if you want to join us as a fresher, or rather, direct entry from the school, you need to have a C-plane mean, KCSE C-plane mean, and you need to have a C-plane in biology, and also a C-plane in one of the languages, that is English or Kiswahili. And there is an extra subject known as an extra science subject, which are categorized as mathematics, physics, or chemistry. Under that, you need to only get a mean of C-. So once you have that, you are ready to join us. Yes. And for those who are higher national diploma, those who are specialists, what you need to have is that first of all, you must be a registered nurse, meaning you must be a nurse at diploma or degree level for you to join our institution. Once you are registered by the Nursing Council of Kenya and you are fully licensed and your license is valid, you need to have worked for at least 1 year post-graduation. So that way, and you are interested in, we do for you interview just to see that are you joining because of interest or you are joining because others are joining. So once you meet those criteria that have been set by the Nursing Council of Kenya, then you are able to apply through our website, whereby we have placed our application processes there and documents. You download, you fill, we get those forms, and then plus your copies of your certificates. We set an interview, and if we find you ready to join, then of course you'll join the next.
There's so many nursing institutes and research centers in the country. Why do you think Gertrudes Child Health and Research stands out?
Competitive. Actually, Gertrudes is the place to be. The name sells itself. The moment you arrive in Gertrudes, the environment alone will attract you. So people who have come here to inquire, if they come physically to inquire, they don't go away. They say this is the place to be. So one of the things is the ambience of the place. Yeah, Gertrudes Children's Hospital being a children's hospital and Gertrudes Institute of Child Health being an affiliate of the Children's Hospital, our approaches of doing things are very different. First of all, we are child-friendly. So most of the people who come to us, we still consider them children. You know, they are around 18 years to 21, and they fall within that cohort of pediatrics. So we love them. There's a way we handle them. There's just an approach that we give them that really attracts them to come. So first is the environment, in terms of their physical environment, and also just the culture of the people. Our tutors or lecturers are really trained such that they are able to really interact well with the learners. They are very courteous, they are very knowledgeable, and they are highly educated. By the way, we choose well. For you to teach in our school, you must have a degree and above. And majority of them have masters in what they are doing. So they are highly specialized. And what does this do to the learners? The learners learn in a good environment, good interactions, they are loved, and they post very good results in the national exams. Actually, we normally post 100% pass rate. I think we are the only school that continuously posts 100% pass rate. Other than that, for our diploma students, we have agreed with the human resource manager that upon graduation, we give them job opportunities. Whenever a chance arises in our hostel, we tend to give our own, those who have trained with us. So they are very, very competitive within Gertrudes and outside Gertrudes, especially the specialist nurses. They are sought after. Remember, we are the only institute that train that specialty. So, and all the hostels are now having departments of pediatrics. So our nurses are very, very sought after.
Firstly, you being a research institute also, so are you spearheading any research among children conditions?
Yes, we are on the forefront of doing research. We have a research department within the hostel. So the hostel and the Gertrudes Institute of Child Health and Research work together. And we have a lot of data, which we are analyzing and giving reports. So yes. And also the students who come to learn with us, we introduce them to the research methods, and they're able to start the proposals. And once the proposals are very good, we help them to carry out those research to full completion.
And before we go, anything else that you want to say to our audience or tell our audience?
Those who are interested in joining us, because that Gertrudes Institute of Child Health and Research is the place to be. And especially if you love children, come and train with us. We don't want to lose children. We don't want children to be managed by those who are not trained. So if you are interested in joining our institute, we have our contacts in the website. www.gertis.org. Therein, there is the training school page where we have all our details.
We've learned a lot about Gertrudes Institute of Child Health and Research, and to nurses who want to specialize in pediatrics, this is the place to be. And that's where we end our interview today. My name is Bildin Waliula. See you next time.